Good morning, students. Today's class is about renal function test or kidney function test. Okay, it is called as RFT also. So we'll be looking at the function of kidneys and what all tests we do in laboratory to assess renal function. Okay, so all those will be same. So if you look at the anatomy first, so you can see the urinary tract system, how it is, or the kidney excretory system. Kidneys are there, ureter, bladder, urethra, then there is ureter opening. So these parts are there. And if you look at the structure of nephron, so all this you would have studied in your previous classes and all. So there is glomerulus, then arteriole, afferent and efferent, PCT, proximal convoluted tubules are there, loop of Henle, all these are there. So I want you all to refer physiology for the function, and you have to make a note on how urine is formed, formation of urine. So that will be one of the important questions in your exams. So you should make a note on that. I'll be telling about the kidney functions now. Okay, so kidney functions you all know. Okay, first is it regulates water and electrolyte balance and acid base balance. Then arterial blood pressure, this is also regulated by kidneys, and it excretes waste, metabolic waste, okay, and foreign chemicals also. And few hormones like renin, erythropoietin, and 2,5 dihydroxy cholecalciferol, that is your vitamin D. So all these are synthesis has a role, kidneys role is there, it is secreted by the kidneys. And metabolic function, gluconeogenesis, or gluconeogenesis means a new glucose is synthesized. So all these are the important main functions of kidney. And now coming to proper kidney function test, here the kidney function test and the clinical utility, that is in the laboratory. It is divided into 4 groups. So first is overall function. To assess overall function of kidneys, complete urine analysis is done. Then measurement of non-protein nitrogenous substances in blood is done. Then measurement of serum electrolytes. So all these are the tests that are done to assess overall function of kidney. Then to assess glomerular filtration rate, so is the kidneys glomerulus working properly, is the filtrating rate GFR is okay. So to check that, clearance tests are done. So under clearance test we have creatinine clearance, urea clearance and all, okay. Then to assess glomerular permeability, microalbuminuria and proteinuria. So these are the two tests that are done. Then to assess tubular dysfunction. So if the tubules are okay, if it is any problem is there or is it normal, to check that osmolality of both plasma and urine is done. Then concentration and dilution tests are there. Renal acidification tests. Okay, so all these are the kidney function tests which are divided into 4 different groups. Okay. Now, to come into the physical characteristics of urine, so when to assess overall function, urine analysis is done. No, so you have to know about the urine analysis. So physical characteristics per day, normally we will excrete 1000 to 1800 or 1 to 2 liters of urine. Okay, per day. Then this is increased in diuretic therapy, diabetes mellitus insipidus, and urine excretion is decreased in renal failure, dehydration, excess. So if a patient walks in, if his urine excretion is less, then we have to rule out all these conditions. If it is more, we have to go through these conditions. Increased excretion or output, we call it as polyuria, that is more than 2.5 liters per day. Decreased output, we call it as oligouria, and completely less, if it is less than 50 ml per day, we call it as anuria. Then appearance, the urine should be clear and transparent. If it is turbid, then it indicates the phosphate content is more in urine, and in UTI also, urinary tract infection also, the urine appears turbid. Then aromatic odor is a normal odor. If it is the smell of acetone, if you are getting, it is diabetic ketoacidosis. Then if it is fishy, then there is hematuria or excretion of RBCs or hemoglobins in presence of blood. Then color. Normal color is amber yellow. If it is highly colored, deep yellow, it is seen in the jaundice condition, as you all know. If it is red color, it indicates presence of RBCs or hemoglobin blood. Then pH, it ranges between 5.5 to 7.5. Usually it is acidic around 6. So that is decreased in acidosis, increased in alkalosis. Then specific gravity, the normal range is 1.016 to 1.022. This is measured using an instrument called as urinometer. The specific gravity increases in diabetes, mellitus, nephrosis and sweating. It decreases in excess water intake. So chronic nephritis and diabetic insipidus. If the urine is more dilute, the specific gravity is decreased. If the urine is concentrated, specific gravity is increased. Then, so these are the tests which we do. So chemical characteristics to assess. So first is reducing sugar. That is, reducing sugar in normal urine, it is absent. If it is present, it will be in all these conditions. See, diabetes, gestational diabetes, renal glycosuria, pentosuria, galactosemia. All these are the conditions where there is presence of reducing sugar. Okay, so to assess or to detect presence of reducing sugar, we do Benedict's test. Then ketone bodies also. In normally it is absent. If it is present in these conditions, diabetic ketoacidosis, starvation, then von Gerke's disease. So these are the conditions. Test that is done is Rotheros test and Gerard's test. Then protein also. Protein, to detect protein, we do heat and acetic acid test, sulfosalicylic acid test commonly. Heller's test is not performed generally. Then these are the conditions where there is excretion of proteins: nephritis, glomerulonephritis, nephrotic syndrome and pyelonephritis. You can see how if it is present, it will be white precipitate will be there. Then blood, normally it is absent. If it is present, so all these conditions. If there is any stone in the ureter, when there is inflammation to the glomerulonephritis, when there is renal tuberculosis, okay, all these conditions, UTI. So these are the conditions that will lead to the presence of blood in urine. So if the blood is present, we get green color like this when we perform Benedict's benzidine test. Next, bile salts and bile pigments. These also are not present generally. If it is present, mainly it is seen in obstructive jaundice and in some cases viral hepatitis and alcoholic hepatitis. Okay, all liver related diseases, bile salts and bile pigments are seen. Here you can see Hayes test is done and Fauchet's test is done. Hayes test is for bile salts. So for the urine sample you take and add sulfur powder. If the sulfur powder sinks to the bottom, there is presence of bile salts. If it is not sinking, it is absence of bile salts. We do Fauchet's test for bile pigments. We get a green color. Next. So other parameters like urea, uric acid, creatinine, all these are also done in blood to assess renal function. So in renal disorders, these usually will be high. Okay, increased levels are seen in kidney dysfunction. Normal blood urea is 20 to 40 milligrams per deciliter. So this is the end product of protein metabolism. In renal dysfunction, the value goes high. Uric acid, this is the end product of purine metabolism, 3 to 7 milligrams per day. This goes high in renal dysfunction. Creatinine, so this is the main parameter that is used to assess renal function. So 0.7 to 1.4 milligrams per deciliter is a normal range. I'll tell you in detail. Then electrolytes also is analyzed, okay, to see if the PCT, loop of Henle and DCT are functioning well or not. So here sodium chloride, bicarbonate and water. So these are the substance reabsorbed and secreted as H plus ions, ammonium ions and organic acids and bases. So loop of Henle, again it reabsorbs sodium chloride, magnesium and all. So these are the things that are reabsorbed. So reabsorption and secretion of electrolytes is essential for the maintenance of acid base balance. So by analyzing the electrolytes, we will come to know if the reabsorption is going on smoothly, if it is working normally or not. Then I told you clearance test. This is to assess glomerular filtration rate. So this is a useful index to assess severity of kidney damage. Okay. So here clearance means what? Clearance is defined as quantity of blood or plasma that is completely cleared of a particular substance per unit time. So that is the definition of clearance. Or you can call it as ml of plasma, which contains the amount of that substance excreted by kidney within a minute. So this GFR, clearance test, usually it is given in ml per minute. How much of ml is cleared per minute? So types of clearances we have: creatinine clearance, urea, uric acid clearance, and exogenous markers like inulin clearance, para-aminohippuric acid clearance and diodras clearance. So all these are endogenous and exogenous markers. So calculation for clearance test is U into V by P, where U is concentration of substance in urine, volume of urine excreted per minute, and concentration of substance in plasma or serum. So suppose for example creatinine clearance test we are doing. So U means how much of creatinine is present in urine. Okay, concentration of creatinine in urine. V, volume of urine excreted per minute. Then concentration of creatinine in plasma or serum. So all these three values we put if we are doing it for creatinine. Then we calculate the clearance. If it is for urea, urea concentration in urine, urea concentration in serum you measure, put it in this formula and analyze. So clearance test Otto Folin. So it was estimated in 1904 by him. And formation of creatinine is continuous and spontaneous, and it is non-enzymatic. So this is dependent on the muscle mass also. So creatinine clearance normal range is 85 to 125 ml per minute. So inulin clearance normal range is 125 ml per minute. So inulin means what? In the carbohydrate chemistry you would have studied. It is a polysaccharide of fructose. This is neither absorbed nor secreted by the tubules. So serum creatinine, I told you, this is a better marker for to analyze kidney function than the clearance test. Okay, serum creatinine is more accurate, and throughout the adult life it is almost constant. So you need not worry about the other clearance tests. So creatinine is important. And this clearance, when it is recommended, when there is early renal disorder, early renal disease, and the possible in the kidney donor, to assess the donors, then to detect renal toxicity of some nephrotoxic drugs. So in all these conditions clearance test is advised. Then classification of chronic kidney disorders in case of based on GFR. Okay, if the GFR is more than 90, okay, so the kidney disease is there, but the GFR is normal. In stage 2 it will be decreasing. Stage 3, 4, 5 you can see the GFR goes on decreasing. If it is below 15 we call it as renal failure. Then urea clearance, I told you maximum is 75 ml. Then standard urea clearance is around 54 ml per minute. So than this urea clearance, creatinine clearance is reliable. Then to assess the permeability, there is microalbuminuria, I told. So minimal albuminuria, that is microalbuminuria means small amount of albumin in urine or small quantity. So this is 30 to 300 milligrams per day. and the cause is high permeability of albuminous and renal glomerulus. So this indicates or this acts as an early marker for nephropathy in patients with diabetes and hypertension. So measurement by ELISA and immunoturbidimetric method. Then test for renal function test. So measurement of urine volume. So I told you oliguria, polyuria and all. So per day how much of it is excreted we will analyze. Then osmolality by using osmometer. Normal is 62,200 milliosmoles per kg. So depending on the disease conditions, this osmolality is varied. Then specific gravity, I told you, using urinometer we will be doing. So early manifestation of renal disorders and difficulty in concentration of the urine, that leads to alteration in specific gravity. Then concentration tests. So concentration test, how it is done: subject is not allowed to consume food or water after 6 p.m. till next day 7 a.m. When the bladder is emptied, a second specimen is collected 1 hour later and specific gravity is measured. If it is more than 1.022, this indicates normal renal function. Then dilution test. To detect dilution test, the patient is not allowed to drink water after midnight. Okay, morning after emptying bladder, water load of 1200 ml is given for about 30 minutes. Then hourly urine sample is collected separately for next 4 hours. Then each sample volume, specific gravity and osmolality is measured. Then normal response, almost all water load is excreted by 4 hours. One of the 4 samples shows specific gravity falling to 1.003 and osmolality to 50 milliosmoles per kg. So this dilution test is more sensitive. That is one advantage. It is feasible and less harmful than the concentration test which we are doing. Then urine acidification test, acid load test. So we give 0.1 gram per kg body weight of ammonium chloride. Then we will see the acidification. We will measure the acidification. So when ammonium chloride is taken inside, what it does, so ammonium chloride is split into ammonium ions and chloride. This ammonia is converted to urea by liver, the detoxification process. Then this chloride will combine with one more H plus ion, then HCl is there. So this HCl is excreted in urine. That causes urine to be acidified, or it causes acidification. The amount of acidification we calculate. Okay, so urine is collected hourly, around 2 to 8 hours after ingestion. Then pH and acid excretion in each sample it is noted. So at least one sample with pH 5.3 and ammonia excretion of 30 to 90 millimoles per hour. So this is a normal range. When the pH is low, in chronic renal failure it is low, and in tubular acidosis the 5.3 is not achieved. So here you can see the summary of this renal function test or kidney function test. So all these are the criteria which we have to see. To see GFR, glomerular filtration rate, we do clearance test. In clearance test I have told you urea, creatinine and inulin, many clearance tests are there, and the formula U into V by P. So all this I have told you. Then endogenous substance clearance, that is creatinine clearance test. Exogenous, it is inulin. Then to assess physical characteristics, we saw the volume, appearance, it should be clear, color, it should be amber yellow, and odor and specific gravity. So in what all conditions this is changing, what should be the normal range I have told you. Specific gravity normal range, and it is used in urinometer. In what conditions it is increased, decreased I have told you. Then abnormal constants like reducing sugar, ketone body, protein, what test we do, name of the test, and the observation I have told you. Then microalbuminuria, normal range I have told you. This is used to assess what and in what condition it is useful I have told you. Then tubular function, There is specific gravity, concentration test, urine volume, osmolality, and dilution and acidification test. So these are the uh, tests that come under renal function test. Okay. So when should we assess renal function? So when there is the risk such as diabetes, hypertension, systemic lupus erythematosus, and UTI, obstruction, all these conditions, we should assess renal function. Then to diagnose renal disorders, to see the response for the diagnosis and prognosis of renal disorders, then chemotherapeutic drugs, then renal replacement therapy, all these conditions we need to compulsorily assess renal function. Okay, so I hope renal function is clear for you all. Okay, thank you.